Good day. On behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, I'm Dr. Dangleben with your medical tidbit of the day. The topic today is hydrochlorothiazide. I want to bring this home because I have spoken about a lot of medication as it relates to high blood pressure. And the high blood pressure is what I call our silent killer, all right? It affects our community more than any other group in the United States, in the Caribbean, in the world over, okay? And we have to be able to educate ourselves to fight back, right? I will use United States as example. 1 in 2 black adult in the United States has high blood pressure. It starts earlier than we think, right? And as we go along denying it and being sedentary, alcohol use, and everything else, morbid obesity, it worsens. And sometimes by the time we get to our mid-30s to late 40s, it's already too late. And that's why we have a lot of folks on dialysis, right? You have an increased risk of stroke, kidney failure, heart attack, and obviously mortality, death from that. Hydrochlorothiazide is what's called a thiazide diuretic, a water pill, all right? It helps your body get rid of excess salt and water, thus lowering your pressure. That's why it's important in reducing your salt intake, right? And it is considered the first-line medication for black patients with high blood pressure, all right? And this is not about denying and saying, well, I'm going to go natural, I'm going to do this, I'm going to do that. You can opt to do that, but I am telling you what's out there and what works, and this is scientific base, all right? We black people have what's called a salt-sensitive high blood pressure, and hydrochlorothiazide works directly against that, all right? And there's studies out there to show that it works better than the calcium channel blocker, the ACE inhibitors that I have spoken about, all right? And the good thing about it, it is one of the cheapest antihypertensives out there. It reduces your risk of stroke and heart failure. And that is the key, because too many strokes, too many heart attacks, right? But like any other medication, there are side effects. And anything you take, even the stuff in the natural world, has side effects, right? This will drop your potassium level, so you have to be cognizant of that, right? You may urinate a lot, right? It's a water pill, so you have to also be cognizant of that. Certain groups of patients get muscle cramping, all right? And just something to think about, right? So it's important when you're on any medication that you have annual or biannual lab work, so to follow up on your electrolytes, right? Your sodium, your potassium, your calcium, your magnesium, and see where you are in that regard, all right? So this is about empowering ourselves with knowledge. And it's lacking, guys. It's lacking, all right? Take your blood pressure. Follow up with your doctor. Take your medication. Eat less salt. Try to stay as active as possible. Drink an adequate amount of water, right? Get a blood pressure cuff if you have to. And don't be afraid to ask questions about your medications. It's your right. Your health is your right, okay? So remember, these medications are not just a pill or some chemical to kill you. The other things I mentioned, the high salt, the morbid obesity, the diet, the food that we eat, these are the things that's the weapon that's destroying us, okay? So knowledge, lifestyle change, and regular care are so important. Don't wait for, mini strokes or kidney failure, especially if you live in an environment where, dialysis and things like that are not readily accessible. You got to put it together in context, all right? So this is all I have for you today. Have a great day. I'm Dr. Dangleben on behalf of Patient Choice. Check us out in Chemin, Pointe, Michel. More to come. Peace.